find out. Thanks for watching. Let's talk about saw palmetto. Saw palmetto is one of about 30 phytotherapies or herbal therapies or botanical therapies available to treat benign enlargement of the prostate. It's from an extract of the berry of the American saw palmetto. That's also referred to as the cabbage palm or the dwarf palm or the scrub palm. Medically, we know it as Serenoa repens or Sabal cerulatum. Estimated as many as 2 million to 2.5 million people take the product every single day. It's native to the swampy and coastal lands of the southeastern United States around Florida, a little bit into South Carolina, Alabama, Georgia, and Texas. Also grows in the West Indies and now in the Mediterranean areas. It's named for the sharp saw-toothed edges on the fan-shaped leaves. The berries themselves are dark in color. They're slightly less than an inch in diameter. They have a solitary pit. They're harvested in the fall. They ripen mostly October, November, and December. But as with any herbal product, you have to consider nature. So are we having hot times? Are we having humid times? What's the growing condition? What's the ripeness of the berry when they're picked? How long are they left to dry? What kind of extract do we use? All of that's very important. Well, originally, the berries were used as food by the Seminole Indians. Europeans didn't like the taste. In the 1870s, it was used for medicinal purposes. So gastrointestinal abnormalities. It was used to stimulate the appetite, and it was used by women if they had ovarian problems or if they had menstrual disorders. It wasn't until the 1980s that it was studied medically. Now, we know that about 30% of men, 40% of women are taking a supplement or an herbal product of at least one type. If we talk about specifically the saw palmetto, they're using it mostly for benign enlargement of the prostate and sometimes for male pattern hair loss or to improve the metabolism. But it's also used for a variety of different disorders that don't seem to have any correlation. So thyroid disease or asthma or polycystic ovary disease or cough or sore throat or chest congestion or bronchitis or headache or migraine or sleep-related problems or hypoactive sexual drive. But if we're talking specifically about the prostate, it seems that we can divide the symptoms of benign enlargement of the prostate into irritative and to the obstructive symptoms. So the irritative symptoms would be urgency, frequency, and getting up at night to urinate. Obstructive symptoms would be hesitancy and straining to start the stream or dribbling or retention. And when the symptoms become bothersome, when they interfere with the quality of life, that's when you look for some kind of therapy. Now, unfortunately, these symptoms don't specify a specific disease. So we can't say whether the disorder happens to be in the bladder, happens to be in the prostate, happens to be in the urethra. We don't know where the symptoms are coming from. As a matter of fact, the symptoms are as frequent in women as they are in men. If we were to study the saw palmetto, how might it work in the laboratory? We haven't got any studies on humans, but in the laboratory, the suggestions are, well, it might work as an anti-estrogen or an anti-androgen, might interfere with conversion of testosterone into the active form of dihydrotestosterone, might interfere with metabolism of sex hormone binding globulin, or might work as an anti-inflammatory, might lead to cell death, or might relax the smooth muscle either of the bladder or of the prostate, might interfere with the metabolism of prolactin. All of those are possibilities. For sure, we don't know. Now, a lot of people have a tendency not to want to use the prescription medicines because prescription medicines have some side effects. They have sexual side effects. They might cause you to get dizzy when you stand up. And herbal products have long been considered safe and well tolerated, and free of significant adverse sexual effects. No surprises over a period of time. They're available in tablets or capsules or ground powder, available as whole berries or liquid extracts or teas. But the major brands haven't gone through significant chemical analysis. And even if they did go through chemical analysis, we don't know what the active ingredient is. So we don't even know what we're looking for. It's kind of like, what's the active ingredient in an orange? Well, we don't know. It's the whole orange. You take it and you seem to get the benefit. Is it the vitamin C? No, the vitamin C is just a little tiny part of the benefit of an orange. You can buy Saw Palmetto. You can buy the extract, the raw material. You can buy that from China. You can buy that through Alibaba. There are more than 200 wholesale products, about 140 different suppliers, mostly in Asia, mostly in China, actually. But there's no guarantee of purity or quality. If we look specifically and try to do a chemical analysis of Saw Palmetto, of the extract, we find that there's major difference between the brands. So for instance, free fatty acids could range anywhere from as low as 40% to as high as 80%. The methyl and ethyl esters, well, they could range from about 1.5% to 17%. If we look at the glyceride content, 7% to 50%. The unsaponifiable material, 1% to about 7%. That's where they think one of the products seems to work. Well, all of that's very important because we have these products and we don't know what the active ingredient is. And if we're talking about the free fatty acids, well, which free fatty acid are we talking about? Are we talking about lauric acid or oleic acid? Maybe we're talking about myristic acid or palmitic acid. And what about the unsaponifiable material? That's important because at least in one product, permexin, that's thought maybe that's the active ingredient. Or we talked about the sterols. The sterols actually inhibit some enzymes known as lipoxygenase and cyclooxygenase. That's sort of the way aspirin works. Might be an anti-inflammatory. Well, in order to at least bring some kind of relief to the whole story, the authorities recommend, and the United States Pharmacopoeia recommends, that the product should contain at least 70 to 95% free fatty acids and probably somewhere between 0.2 and 0.5% sterols. But a reference laboratory recently evaluated about 22 products and found 25% of them fell outside that range, and Consumer Reports studied about 6 different brands, and they found that half of them had less than 20% of the label contents. Now, when we talk about the extract, we're talking about extracting it with ethanol or with hexane or with liquid CO2. All of those different extracts provide different kind of products. So the first thing is we extract the material, then we partially evaporate it to obtain the soft extract, and then we get it into solid form. Well, obviously, all of those different extracts and the different processes are going to give us different kind of products. And since we don't know exactly what we're looking for as far as the active ingredient is concerned, we're really behind the 8 ball. And then there are adulterants. Adulterants are added frequently, unfortunately. Some of them from closely related plant species, but other are maybe some unripened berries or some vegetable oils, maybe canola oil or coconut oil or olive oil or plum oil can be added. And then we have to consider the growing conditions. Just as an example, there was something that was marketed some time ago, and it was called PC Spees, and this contained 8 different kind of herbal products. Saw Palmetto was one of them, and it was being marketed for treatment of prostate disorders and prostate cancer, and it seemed to lower the testosterone level, reduce the PSA, inhibit the cell growth, all of which was very good, but unfortunately was contaminated with diethylstilbestrol, an estrogen product. So it was taken off the market. But you have to realize that for the most part, these products are unregulated by the Food and Drug Administration. 1994, it was said, hey, keep your hands off of these products to the FDA. Now, phytotherapy is very commonly used in Europe. About 50% of the people who have prostate disorders in Italy who are given medicines are given phytotherapies. That's as opposed to about 5% for the alpha blockers like tamsulosin or Flomax, and about 5% of the people who are getting medicines like Proscar and Avodart. If we go over to Germany or Austria, well, it's estimated many as 90% of people given prescriptions for Saw Palmetto. One of the common products, one of the original products that was analyzed or was used in a medical study was permexin. Permexin, in a study funded by the manufacturer, showed some benefit, but a lot of people were skeptical. This product, permexin, has been studied more carefully than most. It's made by the Pierre Fabre Medicaments of France. It's extracted by the hexane method. most of the products in Germany by the ethanol extraction, products made from the United States. Well, with all of this confusion, how do we know whether the product works or not? Well, we rely on information that's published, and we rely on some of the rating agencies or the collaborative agencies that look at all the different studies and tell us what they all mean, put them together. Well, that's the Cochrane Group. Cochrane Group's international study group. And they looked at Saw Palmetto in 1998, 2000, 2002, and they said, hey, it looks like there's mild improvement associated with the herbal product. Seems that people improve as far as the nighttime urinations, and they seem to rate themselves as doing somewhat better, seem to have slightly greater urinary flow, but the studies are small, they're short-term, they have various study designs, and we don't have any standard outcomes. But then we started to develop some studies, some very large studies, and these studies came out around 2006. So in 2008, the Cochrane Group re-evaluated Saw Palmetto, and they say, hey, with these new studies, it seems like it's no better than placebo. In 2011, another major study came out, and they re-evaluated it, and they said, from the Cochrane Group, no, we don't have any evidence of any benefit. And all of these long-term studies, all of these studies that seem to be very well done, do not show any significant benefit. And that's even with the collaboration of the National Center for Complementary and Alternative Health. It's a division of the NIH that was sort of looking over the shoulder of some of these studies. And another study was done from the University of California, San Francisco, and the San Francisco Veterans Hospital, and the Kaiser Permanente of Northern California. And again, they received funding by the National Institutes of Health. They looked at a different extraction method, and they found, whoop, doesn't seem to do any good. Doesn't seem to cause any benefit. Then another study was done, this in 2011, and what they did is they did a dose escalation study. The standard dose is about 320 milligrams a day. So they studied people 320 milligrams for the first 24 weeks, and the next 24 weeks they received 640 milligrams, and then they received 920 milligrams. Carried on for about 72 weeks, used one of the products that's very commonly used in Germany, put it in a blister pack so that people didn't know whether they were taking the medicine or taking the placebo. And the result of the study didn't show any difference. Didn't show any difference in the AUA symptom score, didn't improve the complaints, those lower urinary tract symptoms, didn't improve the nighttime urinations or the flow rate or the residual volume or sexual function. Didn't find any kind of benefit. But interestingly, 42% of the people receiving the Saw Palmetto seemed to note improvement. Well, that's good. So about 40% of the people seem to see improvement. But about 44% of the people receiving the placebo seem to find some improvement. So when we look at the studies, the large studies, we find that it doesn't seem to work. Now, there was a study that compared permexin to Proscar. And actually, that study showed that the permexin worked every bit as good as the Proscar, seemed to improve the urinary symptoms, didn't seem to be any different whether you took the active ingredient or you took the permexin as far as the getting up at night to urinate. The urinary flow seemed to be the same. Prostate size, well, it was markedly reduced with the Proscar, not really significantly changed with the permexin. So we have high quality studies looking at the urinary flow, no difference. If we have studies that look at the prostate size, no difference. There was one study, and it was published in the British Journal of Urology in 2018. It was a Spanish study, one Italian group. And they looked at a meta-analysis of some of the studies. And they said, well, it might work. It actually might work. It might do some good. Side effects? Well, we don't have any serious side effects. No significant difference from taking a placebo, actually. Some people complain of a variety of issues, maybe a little diarrhea or dizziness or gastrointestinal distress, but no difference from placebo. Now, some people have had chemical hepatitis or rare cases of something known as intraoperative floppy iris syndrome that happens with Flomax, and that was when it was originally approved by the German government. And it was actually on the label that it could cause the floppy iris syndrome, but now it's not listed as a complication anymore. Have to realize that it doesn't prevent prostate cancer, but it may sensitize the normal cells in the prostate to radiation damage, but not change the prostate cancer cells. So that means if you do develop prostate cancer and you do go through radiation therapy, you might suffer increased toxicity. Well, there are some drug interactions, so it could interact with warfarin or some of the other medicines that make you bleed, so you've got to be careful of that. May change some of the drug metabolizing enzymes, especially affected seems to be estrogen, can block the estrogen receptors, so people who are taking the birth control pills or people who are taking hormone replacement therapy after the menopause may be negatively affected. Certainly if you're taking the drug and you notice any change, any significant change, any downward change, you notice blood in your urine or pain while you're urinating or urinary retention, then you ought to talk to the doctor. Well, the European Medicines Association says the hexane extraction, that's the way to go. That's the French material. They say the ethanol extraction, the CO2 extraction, we don't have significant enough information, even though those are very commonly used in Germany. Well, when the European Medicines Association came to that conclusion, there were four countries that said, you know, you guys are not accurate in your assessment of the problem. Saw Palmetto is recognized by the German Commission E. The German Commission E evaluates herbal treatments for safety and efficacy. So it's a legitimate product as far as the German government is concerned, and most European nations. The most common dose for the commercialized extract is 160 milligrams twice a day, or 320 milligrams once a day. You could take the whole berry, 1 to 2 grams a day, or you could take a standard extract, 100 to 400 milligrams twice a day, or as I mentioned, the lipophilic extract, 320 milligrams a day. The sales of Saw Palmetto are quite enormous. It's probably in the top 5, ranked as high as the 3rd most frequently sold herbal remedy. Sales are about $150 million a year. The FDA doesn't authorize it for treatment of any medical disorder, doesn't guarantee that it's pure, doesn't guarantee that it's effective, doesn't guarantee that it's safe. The National Center for Complementary and Alternative Health, that's part of the NIH, was renamed the National Center for Complementary and Integrative Health. They say their scientific evidence, at least at the present time, does not support using Saw Palmetto for any medical condition. And that's the group that tends to promote herbal therapies. They say that there are no high-quality studies available that shows that the stuff works. American Cancer Society says, don't look to us. It doesn't do anything for prostate cancer. So basically, there you have it. We have medical information that says that it works about the same as a placebo. We have a lot of people who are taking the product, people who say they're getting better, at least 40% of the people, but we also have 40% of the people who are taking placebo who say they're getting better. If you have symptoms, does it hurt to start with Saw Palmetto? No. Could it hurt you? Theoretically, if you have cancer of the prostate, you don't want that to be the cause of your symptoms, so you want to check with the urologist, check with your family doctor. But overall, the evidence supporting Saw Palmetto just isn't there. Anyway, thanks for watching. If you have any comments, let us know. If you've enjoyed the show, subscribe, maybe tell a friend. I'm Dr. Ken Landau. Thanks for watching.